hesitant about getting vaccinated and you have a question, ask somebody. Let's get your questions answered. Let's get you vaccinated tomorrow.
Every Idaho hospital now under crisis standards of care. The public health messaging of masking up and getting vaccinated for COVID more urgent than ever. Medical leaders from all across the state again today expressed deep concern about a situation considered a last resort. If you need medical care, it breaks down into 4 categories of priority. Essentially, serious injuries with the promise of survival get care first. Second, people with serious but non-life-threatening issues, minor injuries follow. Those are not expected, and those who are not expected to live are seen last. This is the first time Idaho has ever been in this situation. Many Idahoans are wondering, what happens if I need help? Our Tristan Lewis spoke with one man in this exact situation. Tristan, what's the situation for him?
So, Mark, Robert Canyon out of Weiser told me he just found out he needed surgery for colon cancer. A lot of details about scheduling are still being worked out, but he dealt with something similar last year when hospitals paused some elective surgeries and he needed to have surgery for prostate cancer. For him, it's something he doesn't have a choice to wait on.
I've never seen any volumes even close to what we're seeing in my history of St. Luke's with 14 years.
Idaho hospitals are seeing COVID-19 infection rates so high that staff and resources are overwhelmed. The rise in hospitalizations has prompted the Idaho Department of Health and Welfare to activate crisis standards of care statewide.
If we continue on this course over the next several weeks, St. Luke's health system will become a COVID health system. We will consume every single bed and every single resource we have with COVID patients in our hospital.
While not all hospitals in the state are operating at crisis standards of care, St. Luke's health system is, and others are very close. It's forcing doctors to now make difficult decisions on which patients they can treat at any given time.
It's going to decline simply because a caregiver can't get to a patient fast enough.
With resources and care needing to be rationed at hospitals, it's sparking fear in Idahoans who need certain procedures done that are unrelated to COVID.
If this COVID thing hasn't been going on, there wouldn't be any need to worry about if I can get into the hospital and when I'm going to be able to get into the hospital and how I'm going to get into the hospital and how many decisions have to be made before I'm permitted to be admitted into the hospital.
Robert Cannon of Weiser had to postpone a surgery to remove a tumor last year because some hospitals were pausing elective surgeries. Thursday's news is a stressful one for him and many others.
The cancer is still in my system. Now it's in my colon.
He says he's not getting many answers about when he can schedule a time for surgery.
And now I'm in the same situation this year, and it's kind of scary. I mean, either I get this surgery or, if I don't, it's all looks bad for me.
For Cannon, the choice to get vaccinated was an easy one.
Not only protect myself, but protect everybody around me.
Just more than 50% of eligible Idahoans are vaccinated, while the unvaccinated make up more than 95% of COVID-19 hospital admissions. Cannon, just like many of the Idaho health leaders, asked for people to get vaccinated so things can eventually return back to normal, and so he doesn't have to worry more than he already has to.
I'm just left in limbo. I wish people would consider other people's situations.
And again, not every hospital in Idaho has moved to crisis standards of care. Facilities that are able to manage their current circumstances can continue to do so for as long as they are able. But Mark, many health leaders say that day is not far off with the current rate of hospitalizations.
So frightening, so sad, so frustrating. All right, Tristan Lewis, thank you.